Hello, my name is Dr. Marc Orlando. I'm a physical medicine and rehabilitation interventional spine specialist with Mayfield Brain and Spine. I'm a former physical therapist and have background and training in physical medicine and rehabilitation. I am board certified. I'd like to talk to you today about an important but often overlooked cause of low back pain. The sacroiliac joint is located in the pelvis. It links the iliac bones to the sacrum. The sacroiliac joint is stabilized by a network of ligaments and muscles which also limit motion. The normal sacroiliac joint only moves a small amount. The description of motion is called nutation and counternutation. Usually it's 1 or 2 degrees in men and 2 to 4 degrees in women. Like any other joint in the body, the sacroiliac joint can degenerate and/or its supporting ligaments may become injured or inflamed. Common complaints of those suffering from sacroiliac joint pain include lower back pain, a sensation of lower extremity numbness, sometimes in the front of the thigh or sometimes down the back part of the thigh into the calf, tingling, weakness. They may also have pain in their pelvis or buttock, hip or groin, and they often complain of feeling unilateral leg instability. Their painful side leg feels like it's going to buckle or give out on them. Their sleep is often disturbed. Rolling over in bed or trying to get up from a bed is often a very painful maneuver. Studies suggest that 15 to 30% of chronic low back pain may be from the sacroiliac joint. Other studies suggest that up to 40% of symptomatic post-lumbar fusion patients may have pain coming from the sacroiliac joint. A thorough diagnosis must be performed to isolate the sacroiliac joint as the source of pain. This can be accomplished through a patient presentation as well as history and physical exam, including a physical exam of the lumbar spine, the sacroiliac joint, and the hip joint. A positive Fortin finger test, positive provocative testing, and a positive intra-articular SI joint diagnostic block are helpful to make this diagnosis. There are conservative treatment options for the sacroiliac joint pain patient. These include medications, physical therapy, SI joint injection, and radiofrequency ablation. For those patients with chronic, debilitating pain who have not had relief with conservative treatment, minimally invasive SI joint fusion may be an option. At Mayfield Brain and Spine, we use the iFuse Implant System. The iFuse has a unique patented triangular shape to provide immediate stabilization and long-term fusion of the joint. The entire procedure is performed through a small incision, approximately 2 to 3 centimeters long, on the side of your buttock. Normally 3 implants will be used depending on your size. The procedure takes approximately 1 hour. More than 50 published, peer-reviewed articles demonstrate the safety and effectiveness of the iFuse implant system. iFuse is the only SI joint fusion system with clinical studies demonstrating that treatment improved pain, patient function, and quality of life. In a randomized controlled trial, 90% of patients were satisfied and would have the procedure again. SI joint disorders are a very common cause of low back pain, but it's often overlooked by many physicians. Call to schedule your evaluation today.